all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Hello dear friends, good evening. Hope everyone is doing well. Welcome to BMC Global Live, Al Hilal Health World, nothing but lifestyle. Mpox or monkeypox as it is known is a common cause of concern these days. And to throw more light to the topic, we have with us Dr. MOHAMMAD RASHID TAJ from Al Hilal Hospital, Hamad town. He is a specialist in internal medicine with an experience of more than 13 years. So let's move on to the doctor and know more about Mpox causes and concerns. So doctor, welcome to the show and thank you for joining us today.
Thank you, Jasseela.
So doctor, what is this Mpox? Can you explain in detail for us?
Okay. Mpox is a virus. Let's dive something in history of Mpox. It is also known as monkeypox commonly, but it is a misnomer. In around 1950 to 1970, in some of the laboratory monkey in Africa, scientists found a virus which was similar to a smallpox virus, and they name it as monkeypox.
Oh, that's history.
That's the history.
Okay.
So this is not a new disease. It has been since 1970. So, but nowadays, I will tell you, Jasseela, that now the WHO has changed the name from monkeypox to mpox because it confuses that it's only occur in monkey. But that is not the fact. The fact is mpox is a zoonotic disease. Zoonotic means it can occur in any animals. So we should be like careful with any other animals as well, not only monkey. Then mpox, why it is a matter of concern now if it is since 1970s? Because as we know from our previous exposure to COVID that virus keep on mutating or changing its genetic materials, changing the genetic. Thus, the effect of the virus also change on the human bodies. So, as we know that now there was like monkeypox was also a threat in 2022. It has crossed the border of Africa and affected many other countries. And in 2022, our Bahrain has also one case. Alhamdulillah, nothing was serious. But apart from this year, it has again mutated. So if we talk about the variant, like we are accustomed with the word variant since COVID. That so if we talk about the variant, mpox has two variant, clade 1 and clade 2. So in 2022 it was clade 2, but now a new variant has emerged, that is clade 1b. Clade 1b. That's why as the new variant has emerged and it is crossing the borders, affecting the other countries as well, so WHO has raised a concern about this. So we should stop it before it get a pandemic. Okay. So next, if we talk about more about mpox virus, it is similar of a smallpox virus. The young generation might not be familiar with the smallpox, but it was a very deadliest disease in ancient ages. Now it has been eradicated, thank God. But from the same family, mpox has emerged.
Yes. And doctor, what is the mode of transmission of this disease?
So now the mode of transmission has been told from respiratory droplets, like if we cough or if we are in a crowded place, if we inhale the particles of mpox. So this may be one of the cause. Other is from skin lesions. Mpox has a peculiar skin lesions, and if we come in contact or is a skin to skin contact or is in a close contact to a person having mpox, we can get infected with the mpox. Again, some cases has been reported for the transmission from mother to fetus. So if someone is pregnant and that time if she get mpox, there is high chances that the fetus will also develop a congenital mpox or a monkeypox. So apart from this, yes, mpox clade 1 or clade 2 has shown some sexually transmission, but still we are not very sure about clade 1A or clade 1B rather. And apart from this, yeah, someone asks, okay, blood transfusion, still we do not have any cases reported that mpox has been transmitted through blood. But yes, obviously we are not going to donate blood if we are having mpox. So concluding with the transmission, respiratory droplets, skin to skin contact, transmission from the skin lesions and from mother to fetus. These are the common mode of transmission. If there is any broken skin, it can get easily transmitted. If a person is immunocompromised, it can get easily transmitted to them. If the person is staying in a very crowded area and highly exposed to the mpox variant. Yeah, and one more thing, if someone is taking care of the sick animals also, even domestic animals can have mpox. It's not necessary that only wild animal will have mpox. Even a domestic animal can also have an mpox.
Okay. Now, doctor, we would like to know about the symptoms of mpox.
Okay. So once we get exposed to mpox, it may take about anywhere between 5 to 20 days to develop symptoms, and that 5 to 20 days will be symptom free. Then we will again have a prodromal symptom, that is fever. Fever will be a high grade fever, more than 38, and apart from fever, she may suffer from chills and rigor, that a shivering. She will complain that whenever I am having a fever, I am shivering, I am feeling chills, I am feeling cold. Then there will be a rashes on the body. I will explain you about the rashes. It will be a flat, small rashes, which with a certain time, with passage of time, it will rise. Okay, and in that there will be, it is known as, when it rises, it is known as papule, and there may be a water inside it and a watery liquid, that is like vesicles, and it may become a yellowish liquid, that is pustule. So there will be a certain stage, maybe a red, then little bump with liquid, clear liquid filling it, then there will be a pus in it, and after that it become a scab, like it become dry and fell off. So we have a fever, we may have a skin lesion. Skin lesion may be multiple in our body, or it may be just in a mucous membrane or mouth area. Like only ulcer, there won't be a particularly same like a skin lesion over the body, that bump and nothing will be there. There will be a mucous membrane lesion only. Apart from that, a patient may have cough, patient may have running nose, or viral symptoms like crow's eyes, red eyes, running nose, and some lymphadenopathy, some swelling of the lymph in the different part, especially in the neck area or in the armpit. And these are the common signs and symptoms. It lasts for around 4 to 5 days, this fever, crow's cough and lymphadenopathy and mucosal ulcer will last for 4 to 5 days, and after that the skin lesion will arise, that will last another 5 to 10 days, then it will fall off, and then there will be a recovery phase.
And the lesions will be painful? No.
No, it won't be painful every time, but sometimes it may be painful. Okay. Like you may feel irritation, but it's not itchy rather, okay? Not that much painful that it will bother with the pain, okay? So, this will be the signs and symptoms, and apart from this, a patient may land up in complication as well. If someone develop the complications, the complication may start from eyes, like if someone has a ocular or an eye mpox, it may lead to blindness.
Okay.
Okay, then they may have pneumonia if mpox is affecting the lung. Encephalitis may be seen in some cases, that is swelling of the brain matters, I can say in a gross. So encephalitis we can find in some cases, and secondary infection is also seen. As we know, we have discussed that it is in immunocompromised. If someone is immunocompromised, there will be that skin lesion will attract another bacteria to grow on it. So there will be a secondary lesions.
And who all are at risk of this condition?
Children. A high risk group are those who is staying around the patient having mpox, around the animal. Immunocompromised patient, like who is already having diabetes, hypertension, or any chronic disease, old person, old age person, pregnant woman, and healthcare worker.
And will the mpox, will it lead to death of persons?
Clade 1 variant has shown a very little death, but about 0.1%, but Clade 2 variant last year has shown around 5% of death, but Clade 1b, which is the newest variant, has shown about 3 to 5%, but still these data is not very strong, because the case report is very less. You know, the people are getting well without any treatment, they are not reporting the case. So the data which we are having for the death is from those who are severely ill. So exact data is not available, but still I can say it is much less than 3%. So as there are treatments and all that available, so the death rate is very less in there.
And doctor, how can we diagnose this condition? What are the tests to be done?
So there are various testing methods available. Among those, PCR is one of the most reliable and easy to do and nowadays widely available method. We take a swab, same like we used to take in corona. We take a swab from the lesion. In this mpox, we take a swab from the lesion and we send it for the PCR, where we grow a virus and we see the variants and all that. Apart from this, a culture can also be done, but it takes long time. A microscopic, we can also take biopsy and see the virus in there, but all these are cumbersome process, so we mostly rely on PCR and swab of the, so it is like it is detectable and we know much about it.
Okay, these are the tests to be done.
These are the tests.
And doctor, is there any effective vaccine against this mpox, and do you suggest it?
Okay. If we talk about vaccine, mpox, I have already discussed that mpox is similar to smallpox somehow. So a vaccine which affects smallpox will also effective in mpox. So we all know that smallpox has been eradicated from our globes. So nowadays a new vaccine known as JANOS has been introduced, and it is a live attenuated vaccine. It is very effective and it is risk-free vaccine. The old conventional vaccine of a smallpox is not really given nowadays. We are using a JANOS, a new vaccine for mpox, and it is an effective vaccine. Okay, now coming to whom should these vaccine, who are the person who should receive this vaccine? High risk group people who are there in Africa, they should get it first, because if we vaccinate them, we will prevent the disease to spread. A high-risk group who is dealing with a person who is sick or who is having mpox, or healthcare worker who are at risk of getting exposed to mpox. Apart from this, the vaccine is not recommended to general population now. Okay. But if someone feels that they are in a high risk group, they can consult a healthcare worker for the same. So
the travelers have to take this vaccine. What is your suggestion?
So we are not giving a vaccine to the travelers who is traveling other part of world apart from Africa, okay, or Congo, to be precise, but they has to take a special precaution while traveling. They should avoid a crowded place. They should not wipe their mouth, nose, eyes. As we know, they should take a good hand hygiene care, and they should not share these their clothes or utensils while traveling, and avoid eating uncooked meat. This will also prevent mpox. And there is still there is no travel ban or something like that for the mpox. So travelers are safe as far as they apply hand hygiene cares and use personal protective equipment like masks and gloves if they find they suspect that some area may be infected.
Okay.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
You already mentioned that even if it is not treated, it will go away on its own.
Yeah. Mpox, see, I have mentioned that they may develop rashes. It's not that everyone will develop a rashes. After 4 to 5 days of fever, it may goes away, but at that point of time, we only need to isolate the patient and give supportive care, lots of fluid, water, painkiller, paracetamols, and If someone get a severe disease, their antiviral has shown a promising effect on that, so we can use antiviral as well. So nothing to worry. We have a medicine. We know how to deal with that.
Okay, these are the treatment options.
There are others.
Now, doctor, what are the measures to be taken by the caretakers of the infected persons?
Okay. If someone get infected and somehow we have to take his care, we have to take care of him or her. First thing, isolate him, and while going close to him, we should put a mask on both patient face and ourselves. We should use a disposable gloves. We should use a separate or a disposable utensil for them. A proper cleaning and disinfecting the areas where the patient stay is very important. We should not wash the clothes of the affected person with the other members of the house. We should wash it separately. And we should not allow a gathering in that room.
You already described in detail about the preventive measures. Now, can you put everything together in a nutshell for our viewers?
Okay. So, first thing, we should avoid the crowded area. We should wash our hand properly, and all of us know the hand washing technique, and
yes.
so we should wash our hand properly. We should not put if we are in a crowded area and if someone is coughing or something, we should use a mask or try to avoid that. And if we are taking care of the animals, we should take a proper precaution with mask and gloves before taking care. We should not eat uncooked meat, and rather if it is not well cooked. And apart from this, if we suspect that I am suffering from mpox, then isolate myself. I will isolate myself, seek a healthcare worker advice, and cover the skin lesion, cover our face, and use gloves, disposable gloves, and avoid getting contacts with our family member or other person.
So, doctor, how is the Ministry of Health of Bahrain dealing with this mpox now?
Okay. Ministry of Health is very, very much vigilant for this, and they are having a good eye on the situation in the world, and they are updating every day the required policies in this. They are making the doctor vigilant again, and they are ensuring that the doctors are knowing all the signs and symptoms and everything about the mpox, and they have made a special cells and special designated areas for isolation in their complexes. They have make an appropriate arrangement of the testing facilities and laboratories and appropriate arrangement for the medicine. Still, we do not have any cases in Bahrain, but ministries are doing wonderful job, and our ministry is taking care of it, so our people should not worry.
So, doctor, before we wind up, what do you have to say about Al Hilal Healthcare?
Okay. I have joined Al Hilal Healthcare 2 years before, and it is the fastest growing medical hospital in Bahrain. And being a part of Al Hilal family, I am really thankful to the management for choosing me to work over here. It's, I can say for the patient, it's affordable, one of the best treatment they can get, and in affordable price in Al Hilal Healthcare. So all of us are working for the improvement of the healthcare in Bahrain for the resident of Bahrain. So that's one of the best hospital I have ever worked. I have worked in various hospitals, but this is one of the best hospital I have ever worked.
Thank you, doctor. And this episode was very informative. Thank you once again.
Thank you, ma'am.
So viewers, I hope you got all the relevant information about mpox. Till we meet again next time, this is Jasseela Mujeeb signing off. Good night.